Frederick Banting and Charles Best are credited with the discovery of insulin in 1921. 2 years later, after scientists MacLeod and Collip purified it for clinical use, they were awarded a patent for the drug's discovery. This patent was then sold to the University of Toronto for $1. Insulin does not belong to me, it belongs to the world, were Banting's noble words. If the scientist who created this life-saving drug intended for it to be accessible to anyone who needs it, why can millions of Americans no longer afford to pay for a single vial? Hi, my name is Shravya Sethi, and I was diagnosed with type 1 diabetes 6 years ago. Frederick Banting was 23 when he discovered insulin, but I was only 9 when I discovered my discontent with the American healthcare system. For a little perspective, this vial of the insulin I use costs $380 retail, lasts me about 10 to 15 days. For an uninsured patient, that's $11,750 of insulin every year, or about 1/5 of the average American annual salary. I have insulin now because of the support of my parents, but I am scared for the day I'm removed from my parents' insurance at 26 and I have to support myself. Insulin is just not affordable. So what is it driving prices up? It's not production cost. A vial of insulin costs $3 to produce. Part of it is evergreening, where pharmaceutical companies make incremental changes to their drug, extending their patents. This prevents generic drugs from being produced, so Big Pharma can charge their insane prices under the guise of innovation. But even if patents do expire, generic drug makers are scared away from manufacturing insulin due to the extensive cost of approval and manufacturing. Another part of it is limited competition. Eli Lilly, Novo Nordisk, and Sanofi are the only 3 insulin manufacturers in the United States. Extended monopolies have caused prices to skyrocket uncontrollably in the past decade. We know this is the issue because when US insulin prices increased by 10.3%, Canada's regulated prices increased by 0.01%. Look to earnings seasons where companies report their quarterly earnings. Novo Nordisk's profits have been increasing by 30% annually for the past 2 years. Clearly, profit is not an issue for them yet. Prices keep on increasing. But why stop the discussion at just insulin and Big Pharma? Let's talk about the healthcare system in the United States as a whole, and it's actually quite complicated, so we'll stick to the basic stuff. You've got private insurance companies, and you've got pharmaceutical companies, aka Big Pharma. Big Pharma manufactures drugs. Private insurance companies offer plans to customers which determine how much you're paying for a drug. To communicate between these two parties, to negotiate drug prices, exist pharmacy benefit managers, or PBMs, the middlemen in the equation that people tend to forget about. It's key that there are only 3 PBMs that control over 80% of the market. It's a virtual monopoly. These PBMs talk to Big Pharma to negotiate a price for a drug. This negotiation is not transparent. No one else knows what that negotiated price is, not even the insurance company. The PBM then goes and tells the insurance company, hey, here's what the drug costs, trust me. But why do PBMs exist in the first place? Why can't private insurance companies communicate directly with Big Pharma about prices? Well, healthcare is complicated, as we've established. These PBMs figure out the details, develop the contracts, work with pharmacies and wholesalers, while insurance companies focus on, well, being insurance companies. But the thing is, PBMs also tell the world that they negotiate drug prices to bring them down. The thing is, we don't know that because they don't tell us what they're negotiating, what rebates or incentives they're receiving. It's not transparent. Let me explain further. Say there are 3 brands of insulin. One pharmaceutical company wants to promote their specific brand of insulin over the others. But remember, there are only 3 PBMs, so these pharmacy companies don't have much to work with. So in order to get their specific brand of insulin out into the market, they have to offer these PBMs high rebates to prioritize their drug. To have high rebates, they need to keep their list prices high. Furthermore, a PBM will always list a specific brand of insulin as preferred because Big Pharma may offer them a higher rebate for that specific type. This means it's incredibly difficult to get any other brand of insulin because PBMs don't want to sell drugs that they don't get high rebates on. But third, the PBM may charge the insurance company $300 for a vial of insulin, but they only reimburse the pharmacy retailer $250, pocketing the extra $50. Ultimately, the customer bears the extra cost. Express Scripts, one of those big 3 PBMs, reported a revenue of $26.6 billion, a 41% increase from 2023. Any profits that these PBMs seek are not out of dire necessity. They're doing more than fine. Patients are not. Their conditions only decrease. With this explanation in mind, let's re-examine the issue. Insulin is the most expensive in the United States. A Rand Corporation study published in 2020 quantifies that rapid-acting insulin is sold at 1/13 of this price in other developed nations, including the UK, Canada, and Germany. So what are they doing that we are not? The solution likely lies in greater transparency and promoting competition. We could mandate disclosure of price negotiations and rebates offered to PBMs, exposing markups and enabling oversight. We could prevent patent abuse and evergreening, perhaps streamline the FDA approval process for generics and biosimilars to allow for greater competition, ultimately driving down costs. We could adopt similar policies to Germany and Canada, expanding Medicare's ability to negotiate drug prices with pharmaceutical companies. What we can't do is sit here and accept a system that charges wild prices for life-saving drugs, a system that allows profit to accumulate at the top while the patient suffers at the bottom. We need to understand that insulin rationing and diluting due to high costs have killed diabetics. We need to understand the effects of this season of swindling. But seasons are meant to change, and this one needs to. Thank you.